This and my grandpa years ago. He's always been a sporty man and he passed that to me. We used to go play football, tennis or go shopping, until one day he felt shortness of breath, dizziness and palpitation. The reason? He had not seen me for 2 weeks. No, I'm kidding. At that time, my grandpa got diagnosed with a cardiac arrhythmia called atrial fibrillation. This arrhythmia increases the probability of suffering major cardiovascular events, such as stroke or heart failure, thus increasing the risk of mortality for patients suffering from it. This diagnosis, together with other health issues, caused a quality of life deterioration that prevented my grandpa from doing sports and other daily life activities. I am Invers Rubio, a PhD student from IDIBAPS and Clínic, and I was shocked at the time to realize how determinant cardiovascular health is to quality of life. Since then, I got an interest in understanding the functioning of the heart. Luckily for me, years later, I entered the arrhythmia department of Clínic de Barcelona. Once there, I got involved in studying atrial fibrillation non-invasively. In order to do so, in the hospital, we used a tool called electrocardiographic imaging, or ECGI. ECGI is something similar to an ECG, which is a device I am sure you already know, which uses stickers to understand your heartbeat. In the case of ECGI, however, it has many more stickers, so the resolution of the device is higher. This means that we do not have to interpret weirdly shaped signals in order to understand your heartbeat, but we can actually see how your heartbeat propagates. And this is not everything. Not only we get to know what happens in the upper or lower chambers of the heart, but we can differentiate what happens in the diverse areas of those chambers. We can differentiate left from right ventricles, left from right atrium, and even smaller regions, such as the walls of those chambers. In my research, I am using the information that ECGI provides in order to predict if the surgical treatment for atrial fibrillation will work. This treatment consists of isolating electrically some areas of the atria that generate a chaotic heartbeat, so atrial fibrillation, that are called the pulmonary veins. This treatment, however, has a success ratio of about 50 to 80%, depending on the patient. Consequently, knowing a priori if the treatment will be good for that specific patient helps on personalizing the treatment and may encourage clinicians to isolate electrically some other areas of the atria that may generate this chaotic heartbeat, thus tailoring the therapy to the best suit for the patient and increasing the success ratio of the treatment. If we are capable of doing so, of increasing the success ratio of this treatment, we are on the direction of helping people like my grandpa to regain their quality of life and, most importantly, reduce the risk of mortality. Thank you.